Hi, my name is Rachel Baker. I'm a clinical social worker specializing in helping overworked and overwhelmed professionals find peace and purpose. And as part of my Helping Professionals interview series, I'm sitting down today with Jessica Blackwell, owner and nurse practitioner at eVillageHealth. She specializes in providing personalized primary care to patients in Washington and Idaho. Jessica, thank you so much for talking with me today.
Thank you so much for having me. I'm super excited.
Yeah, me too. Me too. First of all, share a little bit about your professional journey that's led you to eVillage Health.
Oh, well, I'm getting older, so my journey gets longer. But I started out as an ICU nurse, and I worked actually at the VA many years ago. And I was finishing up my undergrad program. I was able to get into um, a nurse internship program, which was very unusual in those days. And I followed a very intense ICU nurse that was very tough on me, but I was on the code team during every shift and I worked in the ICU every shift. And back then, we had very high acuity levels. So I learned so much more just having hands-on experience than I ever learned at school. And I just learned a lot about life from the veterans. And, just my compassion is really where it was developed there, just serving people that served our country. I learned back then to support and take care of others. We're all in it together for the patients, and the more we work together, the better. And then the last 15 years of my journey, I've spent taking care of oncology patients, so medical oncology. And they were very complicated, very complex patients that when they had urgent needs, they tended to be truly urgent. So many of them couldn't get into their primary care providers. And I just decided it was time to open my own practice. And COVID kind of led to some opportunities that I hadn't ever considered prior. And so I moved back to my roots, primary care, which I had done. Internal medicine was my very first job when I graduated out of nurse practitioner school years ago. So I've kind of went back to my roots and I opened my own practice. It's called eVillageHealth. And I have a telehealth component, which is visiting with my patients in the similar fashion that we're visiting together. And I also have my in-person component. But that's kind of my journey that led me to where I am today.
Yeah, wow, so much diverse experience that I can just imagine really just sets you up to be able to provide amazing care to your patients.
The experience helps. The experience helps, and knowing that no matter how experienced you are, your patients are always, the master of their body, and they know more about their
Yeah,
body than I do. So being humble also, I think,
right,
helps
right. And being able to partner with them. Yeah.
for
I
sure.
love the vision of eVillage Health to provide personalized quality healthcare that fits into the patient's lifestyle. What's different about your practice that allows you to be able to provide that personalized care?
Well, the first thing is the telehealth. I didn't know if people would embrace telehealth. It is a relatively new concept for all of us. And, even there's typically that hesitation even for a new patient today regarding telehealth. But what we've found is it really eliminates a lot of the barriers to healthcare. Whether you need to be at soccer practice at a certain time for your kids, or you can't leave work, but you're not feeling well. I find people are seeking out a lot more care than they typically would have because they don't have the time. So I've seen people at their lunches, in their cars, after school. And it's interesting because I have reached people that have never had primary care, never seeked out primary care because it's too anxious for them to go to the doctor. But I think beyond that, every level of my practice is personalized. So I listen, I partner, I personalize my cancer screening based on your goals. That's a very personal thing based on your age and your health and your personal goals. If you were to get cancer, would you treat it aggressively? Would you not treat it at all? Like, where are you on that spectrum? So I personalize that. I don't leave it just at cancer screening. I screen for heart disease. I screen for insulin resistance. And if you have diseases, I personalize the treatment plan for you and try to work lifestyle interventions into, I understand we're all busy, but what can we do? What can we do to treat your hypertension beyond just a pill? I try to personalize it to that level.
Really to see the whole person holistically and all of the different pieces that go into illness.
I think you have to treat the whole person. The outcomes are so much better.
Yeah. What do you say to someone who's hesitant to receive primary medical care virtually?
We say give us a shot. Just give us a shot. Let us try one time. And most of the success surrounding virtual visits are based on, do you have the support to help the patient? Because they're nervous. They want to do it right. They're scared they don't know how to do it right. So for me, I have a very technically savvy assistant. It is not me that's the technically savvy one. So she gets on ahead of time. And even before the visit, she can test out the visit, do a test run visit, which she'll do with some of the patients and walk them through the whole process so that when they come on to meet with me, they've done it, they feel comfortable with it. The tables turn on me and I'm like, well, yes, you do have to still see me in person at times.
Right, but that flexibility and just being able to, support the new patients through the initial stages. I've really found that too with counseling, providing counseling for clients that once they get past the fear of the technology pieces and what happens if something glitches or how do we problem solve it, it's works great. What services do you provide?
So my services are very broad. I have quite a spectrum, and it's based on where you fall on the spectrum of health and wellness and illness. And so on one side, I have a very strong preventative program. You meet with me once a year. I give you an hour of my time. You can complete a questionnaire that really dives into the details of your lifestyle. And we go over my recommendations in detail. And part of that wellness program is we also do offer a separate weight loss program for those that are interested in it. And for those that have chronic diseases, I work with you on management of your chronic disease and try to maximize lifestyle interventions. And probably my favorite part of chronic disease management is helping people get off of medications. Helping diabetics get off of insulin and telling them like, this is curable for you. We're getting you off your insulin. You don't have to be a diabetic. Like there's diabetic goals for blood sugars. And then there's Jessica's goals, which are have a normal blood sugar. Yes, you're a diabetic. It doesn't mean you have to be a diabetic. So if you've had diabetes, if it's type 2 for less than 4 years, your odds of cure are almost 100% with lifestyle changes. And even if you've had it for a long time, greater than 10 years, your odds of curing it is up to 50%. So that's my favorite part of chronic disease management. And then I have our urgent care part of our practice, which is truly urgent care. So if you have a need, I see you in, my goal is the next 1 to 2 business days, but oftentimes we'll fit our patients in the day of. And the way we're able to do that is by having a very small practice size. So I'm still accepting new patients. I probably will be for the next, I'm going to guess 9 months. And then at that time, within a year, my practice will close because I'm going to accept patients up until the point where I feel like if I were to take on more patients, I wouldn't be able to manage my patients' urgent needs within 1 to 2 business days. If it's an urgent need to the point of like, do I go to the ER? Of course, they just call me. But it's important to me to keep my practice size small, and I'm able to because I work out of my home. So I keep my overhead low, and instead of taking on more patients and pocketing the increased money I make, instead I've just decided I'm going to take super good care of my patients, and I'm going to give my reduced overhead back to my patients by not taking on so many. So the average primary care provider in the US takes on 2,000 to 2,500 patients per panel. So that's
Wow.
why if you call your provider today, you might not get in for a week. You might not get in for a month, depending on the provider, or 6 weeks even, because they're trying to manage so many people. And many of them don't have a choice, right? They work for larger institutions. Many of them just have big hearts and they're out there to help everyone. And for me, I guess I've just learned as I get older that I have personal limitations. And so I'm not going to save the world, unfortunately, but I'm going to do everything I can to save the patients that are in my panel.
Right,
And
right.
then the last part of my care is end of life care. I'm also a palliative care certified nurse practitioner. So I have the palliative care component of my practice. So I see my patients all the way through health and wellness to end of life, and work with them on strategies to help them feel as good as they can possibly feel. So really, that's kind of the other end of my spectrum of my wellness program. How can I help you feel as well as you can feel for your final days?
Right. So really, in a way, whatever care someone is looking for, there's elements that you'd be able to help them with on that whole, I mean, that's the whole spectrum right there.
I try to cover the whole spectrum. I see patients starting at age 15. So I'm really, an adolescent and adult provider.
Mhm. What about anxiety? Do you work with patients who are struggling with anxiety?
So anxiety is incredibly common, as is depression. And it's really important in our practice to not miss it. So that was something I was taught in oncology, to not miss intervening with someone that has anxiety and depression. So I actually lost a patient years ago to suicide, and I just never forgot. And since then, we've all learned it's important to screen. And that's why, because I don't ever want to have a patient that suffers from depression or anxiety and I didn't ask, so I didn't know. So we screen everyone for their first visit. We screen everyone once a year for their annual wellness visits. And then if you do have depression or anxiety, I follow up in the interim and you get yet another screening. So it's quick, it's easy, and there's so much you can do to help people if you know. It's one of those things that they're probably not going to bring up. But if you ask and you reach out to them, then people will accept help.
And from your holistic perspective, the whole person, mental health is a big part of that. So it makes sense that you would screen for it and make it a priority.
It's a huge part of it. And I love having providers such as yourself that are available to team with me, because I screen for it and I work with the patient, but it's not my wheelhouse. I'm not an expert at that. So I love to be able to refer to experts and work as a team.
Oh, that collaboration, I appreciate that as well, for sure. Speaking of kind of that first session, what does a typical first appointment look like with you?
So your first appointment with me, block out an hour, and it's not a meet and greet. It's not. I view the world through different lenses. So to me, it's an initial consultation. It's an opportunity for someone to lay fresh eyes on your health. So I review all your medical records ahead of time, and I have a bunch of questions for you at your new patient visit. And I kind of dive into the things that are important to you. Our number one question on our new patient questionnaire is, what are your health and wellness goals? What's impacting you? Like, it's one thing for me to want to treat your high blood pressure. It's another thing for you to, but what is your goals? Because I have to address your goals before I can address mine. And oftentimes, more than not, I find our goals are the same. I do an exam via telehealth, and I tell you my perception of your health and wellness, my big picture view of where you are. And then at that point, I order tests, and I set you up for a wellness visit. And I have a 1 hour wellness visit where I go through prevention and how you can stay as healthy as you can. And then I see you once a year following that for prevention. and in the interim when we need to, based on what illnesses you're working with. And for those of us that work with us on our weight loss program, they actually see us more frequently, 8 times in that first month, and then,
Mhm.
well, 9 times in the first month, and then 5 times each month thereafter.
Mhm.
So that first visit, we're really diving into everything because that's where I know kind of how to steer the ship.
That's a
Yeah.
lot of quality time that we don't get normally with our primary medical providers. And what do you wish that people knew about primary medical care?
I wish you knew you deserve the best tailored care. And if you don't feel like you're getting the best care, communicate with your provider because we're all human. And sometimes we make mistakes. And sometimes that communication where, um, you can let your provider know what's not working for you. Oftentimes they can change. And, it's a good awareness for them to know. And also, be active in your care. Set your own wellness goals, evaluate them periodically, and modify them. And just know that you're a partner in your healthcare. You always are the final decision maker. I may have recommendations for you, but you're the one that sets me straight. So it's important to know, where do you draw your line in the sand in healthcare? Because these days we can go so far. And sometimes my patients have to reel me back even and say, you're being way too aggressive. Like, even though you can do all of this, doesn't mean I want you to. And it's okay to tell us that because, that's the human emotional side of me where sometimes patients that don't want to be treated aggressively, and I'm still over here treating them aggressively, and I'm not listening to them. And I have to reel myself in and say, okay, don't let your emotions take over. Listen to the patient, go back to the basics of what their goals are, and then develop a program based on that. So I think it's important to always have your voice because you know your body. You know if something's wrong. And if the first person doesn't listen to you, then go to someone else. But you know if something's wrong, you know what your wellness goals are, be an active part of your care because you deserve it.
Yeah, yeah, I agree 100% for sure. How can people learn more about you or contact you to set up an appointment?
Well, I have my website, eVillageHealth.com.
Okay, I'll be sure
And right when
to
you,
link that. So easy
oh, that would
access.
be great. Okay. Right when you go on that website, you can click on the button for a new patient appointment. And at that point, I'll actually call you and interview you and let you interview me and make sure we're a good fit. And another way you could contact us is our phone number. Call us at 509-960-6527. And you can email us at contact@evillagehealth.com. You can find us on Facebook and Instagram. Um, if you want to just chat with us and learn a little bit more about our practice, just go ahead and give us a call.
Okay, lots of ways to get a hold of you.
Lots of
Is there
ways.
any, that's what we need in this day and age for sure. And to be accessible to people. I mean, that's one of the things that's really important to you is to be open and accessible, available, and to listen to where they are. That's all any of us want, especially when it comes to our health and our healthcare. Is there anything else that you would like to share?
Just thank you for this opportunity. It's a great opportunity. It's not something I would have necessarily thought of. And I really appreciate a forum to be able to share what I'm about. And if this reaches you and you're touched by what I've said today and you've connected with me, I would love for you to reach back out to me.
Fantastic. Thank you so much. I hope you have a good day.
Thank you so much, Rachel. You take care.